Okay, I think let's start, and then I hope that more participants will join us. For everyone's information, this webinar is recorded, so if anyone is joining late, obviously they will have the chance to listen and to participate. Thank you very much for joining. I think we are almost 50 people online, which is amazing. I would like to welcome you to the webinar series of the Data for Nutrition Community of Practice, and this one focusing on visualizing nutrition data for decision making. Today we're going to be talking with colleagues from Tanzania about their experiences from implementing a multisectoral nutrition scorecard in Tanzania. Let me just, sorry, change the slide, there you go. So the topic of today is looking at the experience that the team from the Tanzania Food and Nutrition Center have had in developing and using a multisectoral nutrition scorecard to monitor and evaluate the implementation of nutrition interventions in the country. Before we start, you are all, I suppose, familiar with Zoom. It's one of the most used platforms these days as we are all working and connecting remotely. But just as a recap, if you want to use your Zoom chat, please do write to Riley Hour by selecting all panelists in the chat box. And you see here on the right a short demonstration. And we will do our best to respond during the webinar. There will be also time for questions and answers. So at any time, do feel free to use the chat, or you can hold until the end and you'll be able to ask your questions to the panelists. The moderator is myself. I work for the SUN Secretariat, the Scaling Up Nutrition Movement Secretariat. I'm the Senior Nutrition and Strategy Advisor, and my name is Debora Di Dio. And I'm obviously part of the Data for Nutrition Community of Practice, and I am very excited about this webinar, especially introducing the colleagues from the Tanzania Food and Nutrition Center. The speakers today, we're very lucky. We have 3 speakers online. We have Dr. Germana Leyna, who is the Managing Director of the Tanzania Food and Nutrition Center. We also have Deborah Charwe, who is the Senior Research Officer and Nutritionist at the Tanzania Food and Nutrition Center. And finally, but as we say, last but not last, we have Adam Hancy, who is a Research Officer in charge of statistics and surveys at the Tanzania Food and Nutrition Center. The background of the speakers, you would have seen when we have sent out the invite, where Dr. Germana is increasingly involved in addressing the burden of overweight and obesity in Tanzania. She has a very long experience in nutrition at the government level and at the Tanzania Food and Nutrition Center. Dr. Deborah is a nutritionist who works in policy and planning, and she's focused particularly on providing technical support to various nutrition policies, including, of course, multi-sectoral nutrition information system. And Adam Hancy is a statistician. He has experience in managing multi-sectoral nutrition information systems and smart surveys. So he has supported also the multi-sectoral nutrition plan of Tanzania. So let us go now into a brief outline of the webinar today. We will be going through the introduction, a short introduction and rationale for the webinar. Then our colleagues from Tanzania will describe the scorecard. They will also talk about the system needs in terms of capacity building, human resources, etc. They will present data sources and methods to ensure quality assurance. They will also discuss how it is used, the challenges, and what are some of the current updates. Perhaps before I leave the floor, I just want to congratulate the colleagues of Tanzania, because the multi-sectoral nutrition scorecard is a great example in the SUN movement. And they were also able to present it at the global gathering of the SUN movement, which we hosted in Kathmandu in Nepal in November 2019. And that is where the idea of sharing it more widely was born. So I will now leave the floor to the colleagues of the Tanzania Food and Nutrition Center. As I said, we have Germana, Deborah, and Adam. I'm not sure who will take the floor first for the preamble.
That will be me, Deborah. Thank you.
Germana, great. Thank you. Go ahead and tell me when I should, as I'm managing the slide from my side, tell me when I should go to the next one.
Thank you, Deborah, and the whole team. We are quite honored and humbled to have this opportunity to present, and thank you for the excellent introductions. I thought that we thought it would be great if we give a little bit of intro on what the Tanzania Food and Nutrition Center really is. And we are part of the Ministry of Health, and then we have, it's termed very long, that it's the Ministry of Health, Community Development, Gender, Elderly, and Children. But in principle, it's mainly looking at health and social welfare. It's an autonomous institution that was established in 1973 and became semi-autonomous in 1995. We work very closely with the government, mainly to coordinate, guide, and catalyze all the food and nutrition interventions and programs in the country that are geared to prevent and control malnutrition. We mainly have 3 core departments as well as 2 other supporting departments. We also host a relatively large lab that specifically looks at food and nutrition. And we also have a library that holds lots of repository with all the documents that have so far been developed in the country that look at food, nutrition, and other related information. Next. To start with, so what is this scorecard that we're describing today or we're presenting today? It's basically a web-based tool that is meant to display snapshots of the performance that we have achieved or we have been able to reach on a quarterly basis. And it's based on the National Action Plan, which guides all nutrition activities in the country. So there's a good linkage between how the scorecard works and how the National Multisectoral Nutrition Action Plan, which we call the MNAP, guide. It displays the progress in terms of the key indicators, and this is against our predefined targets that we are meant to achieve every year, midterm, through the implementation of the MNAP and also at the end of the MNAP. It builds on existing information system, so it's more like a platform rather than a primary data collection system. It aggregates all the information that are collected through different sectors, as well as in the local government, in order to avoid parallel system. And the goal was that we have one place where any individual who wants to look at nutrition information in relation to the various interventions that are ongoing can assess and gauge on how far whatever they are doing has affected nutrition. So the thinking began in 2013 when we were thinking how should we move forward with the way we monitor and evaluate. And through the SUN leadership group, we were able to start thinking of this idea. In 2015, we received resources to actually start working on the idea. We had about 75 participants who were together, who together supported the development of these indicators, ironing out of there we think of and which one should we incorporate into our monitoring and evaluations. We are quite thankful for the participation of a lot of government, the different sectors within the ministries, the local government, but also implementing partners, as well as the donor community that is sympathetic to the nutrition cause, were also members in this first thinking of how the scorecard or the multisectoral nutrition scorecard should look like. Next. So we think that the way we design the scorecard is for it to be a dynamic tool that can support different levels from the national level all the way to the local government, as well as partners, to enable them to track progress as they are implementing the MNAP. So we think we would like to consider this as an action tracker, which allows the user as action and individuals to understand when they're underperforming and take actions necessarily. And we believe that this is one way of holding each player nutrition discourse accountable to whatever intervention or actions they are doing. When we're designing this scorecard, we thought of three main attributes that we would really like the system to have. And one of them is that, one, it should track these performances called the key result areas of which MNAP targets. Okay? Now we have 7 key result areas, and we've tried to align the scorecard to work in synchrony with the key result areas. 2, we wanted a system that measures progress in line with also the milestones that we've set up. We know that addressing nutrition deficiencies, specifically such as stunting, takes a while, but we would like to also gauge ourselves with these milestones that we reach in order to ensure that we are headed to the right direction. We also wanted this to be aligned with MNAP, key action points or key action items, so that individuals who are picking one item or one activity at a time can also assess themselves within the greater picture and compare performances across councils on how they have been performing. Next. So in order to add on the complexity of that, we want it to be aligned to all the key result areas in the MNAP. We all know that nutrition is a complex concept. Malnutrition is a complex concept. So we also use our common framework that our famous framework that looks at the various levels of malnutrition, all the way from the proximate causes all the way up to the basic causes. And I thought that it would be quite interesting to our participants to know that this framework was actually developed in the late 70s, early 80s in Tanzania through a project that was also funded by UNICEF. And so when we're looking at the indicators that are in MNAP and how the scorecard functions, it tries to identify indicators that are at these different levels of the conceptual framework. So we have some indicators that assess immediate causes and how they're performing based on the different interventions. We also have some indicators that look at the underlying causes, and we also have indicators that look at the basic causes that are more systematic infrastructure, policies, and the like, that try to gauge whether we are moving in the right direction. So the indicators come from all the levels of causes of malnutrition. And we look at the key result areas are on the right that are aligned to MNAP. And these include maternal, infant, and young child and adolescent nutrition. So we have several indicators there. We look at management of acute malnutrition, so on and so forth, all the way to the nutrition information system, which is more a basic cause for malnutrition. Next. And just a little bit more clarity on what do the indicators look like. I've talked about the indicators being at different levels. And so we have 3 types of indicators. We have those that are measuring immediate actions, which is output, but we have those at the outcome and impact level. Most of the output indicators are measured at subnational level, and these are 15, and they can easily be recorded or reported using routine data that is collected either through the ministry, the health sector or other sectors on a regular basis. Sorry. And then we have national level indicators that are 11, and these are mainly collected either through large surveys, such as the National Nutrition Survey that we have been doing for the past 8 years, as well as DHS. But we also look at various most research studies that have looked at areas that we think are important or can be aligned to the indicators that we have identified. So we have those kind of, those three types of indicators collected at 2 levels, which is the national and the subnational. And all of these indicators, as I've previously said, are linked to the MNAP, which is our document on how interventions should continue or should take place. And they cut across different sectors. So we have some of these indicators that are water related, specific to health related, but also other sectors, but all contribute to the nutrition discourse in the country. And now I'll invite Hancy to take over and tell you more in detail how the scorecard looks and how it works. Thank you.
Adam, are you there? Adam? Perhaps you're muted. We cannot hear you. No, I think you're still muted. Yes, Adam. Hello? I think we cannot hear you, Adam, unfortunately. Deborah or Germana, would you
Hello, everyone.
Yes,
Hello.
we can hear you. Yay. Very happy to hear you.
Hello, I can hear you.
Yes, we
yes,
can.
I am online.
Perfect. Please go on.
Hello.
Yes.
Hello, can you hear me?
Yes, we can hear you. Please go ahead.
Hello,
I think we have some connection problems, unfortunately, from Tanzania.
So thank you very much. I was just so let me take you through the other part of the presentation. Okay, thank you. All right. The scorecard, as it has been said before by Dr. Leyna, it has many functionality. One of them is to enable users to view the data in the way that suits their needs. So the scorecard, as it has been said before, is an online management platform which is basically managed at all levels of use of users. So it can be managed from the LGA level, then the regional secretariat, and the national level. All the levels from the regional secretariat and the national level, we are aggregating the data that are collected from the LGAs. So on the left part, you can see the scorecard itself, a display of it. And then the second one is what we call the action tracker. So the action tracker, this one is very useful because it's a mechanism that the users can peg in several actions towards each of the indicator to measure the performance, not only on the indicator side, but also several milestones that are contributing to that indicator. For example, when we have an indicator which mainly is for uptake of vitamin A, but behind that indicator, we have several other milestones that are needed to be accomplished before this indicator is being measured, such as the ordering of the supplies, making sure that community sensitization has been done. So all these small activities are the ones that we're calling them action tracker that can be used to track the performance of these indicators. And now we have established introduced a work plan manager that is actually meant for the users to feed in their work plan in the scorecard, align them with the indicators that are in the scorecard to make sure that whatever we're implementing is according to the, is being measured or evaluated using the scorecard. On the other part, we have a mobile notification. This is mainly to make sure that people are alerted during the whole processes of implementation of these activities that are aligned with the indicators. And then we have several data visualizations, which helps or aids the users to initiate dialogue and to make sure that we're using the evidence that we're producing every day in our routine work, but also using the survey data. Next, please. Next. So in terms of what do we need within the system to make it happen, to make sure that we are managing the data, we are managing the system routinely, we are making sure that we are producing the evidences that we want. And remember, in our MNAP, we have one of the key thematic area, which is mainly to ensure that we are producing enough evidences that will go and inform decisions, but also inform programming of nutrition intervention in the country. So in terms of the needs that we need, first of all, the pillar, we have managed to put this in four pillars, which the first one is capacity building, and then human resource, infrastructure, and finance. So in terms of capacity building, we need to ensure that the scorecard, the users at all levels are able to administer, but on the second part, to make sure that we have them capacitated in using the scorecard to inform the decision-making processes. If at all we are producing the data and the data that we are producing is not informing the decision that we're making, it means this we are investing in an area which is not productive, but also to ensure that we ensure regular data quality assessment and linkages with other sector systems, because we know nutrition is multisectoral and we are depending largely on data which is also produced by other sectoral department and sectoral ministry. But in terms of human resource, we know that we need to have ideal personnel who can take charge, first in administering, but also to start initiating the dialogue. This is a point where now the data visualization comes, because we need to produce the data in a format that can be user-friendly, but also easy for all people to digest and to make stories out of it. But also in terms of infrastructure, we know this is the ICT things. We need to facilitate data management, either offline or online. So we need to make sure that we have enough infrastructure, but also the basic ones that can make sure, can enable people to manage the system at all levels. In terms of finance, we need to invest on this, because for management of the system and ensure timely and widely use of the scorecard, it means we have to continue financing these processes to make sure that the system reaches all levels of implementation, but also we are producing enough evidences to that end. But the last part where we insist on is to make sure that the small action plan, action items that are produced, that are being developed at all implementation level, are being financed to make sure that we have corrective actions that are pegged in the indicators which seem to be underperforming, to make sure that these indicators are moving into a good direction in the desired target that we have set in our action plan. Next. Next. So I know this is a question that that we have been asked so many times on the issue of data quality, and sometimes it can be harder because the system itself, as Dr. Leyna have mentioned earlier, it's like a repository of data from the other systems. And these all other systems have their own way, their own data quality assurance aspects. So, like currently, we are depending the data that are in the scorecard are fetching the data from HMIS system, which is Health Management Information System. We have the agriculture sector information system. We have the WASH system, education plan rep, and data that are collected manually from the health facilities, and population data and data from surveys. So the data that are collected from other sector platforms adheres to the parent system quality assurance parameters, but those which are migrated manually, we assure that they have passed through validation processes in validation rule analysis, but also making sure that they adhere to minimum maximum outlier analysis, that they're not exceeding the values that are known programmatically. But also currently the data that are being seen in the scorecard are migrated through a Microsoft Excel customized sheet. This means the nutrition officers or the data admins at a local government authority level are supposed to take this data from the parent system and feed in the Excel sheet, which will later be uploaded in the system to produce the scorecard. But the current undertaking is the scorecard, the admin scorecard ALMA have customized. They have customized a way that you can see, you can link the system within DHIS2 platform to make sure that we are migrating the data from DHIS2 to the scorecard platform online. Next. So in terms of the use now, I've talked a bit on how it is and how does it, how is it produced. But basically, the data in the scorecard, the lowest level of data aggregation in the scorecard is the councils, local government authorities, which are moving upwards to the regional level and to the national level. So to start with, the scorecard is being produced every 4 weeks after the quarter ends. So it means if the quarter ends in January, it means in February, the scorecard has to be produced. The process usually starts at the council level where data is being collected. When the data is collected, it will be sent to the regional nutrition officer, where the data will be validated in collaboration with nutrition officers, but also regional officers from other relevant nutrition sensitive sector departments. But also the data will be aggregated at the regional level. And then after aggregation, data will be uploaded in the scorecard using the web platform, and also generate the regional scorecard, but also with the relevant district scorecard, which I will show you later in my presentation. But TFNC has the overall task of ensuring that the scorecard data is being validated, the overall data, but also is consolidated at national level and populated to ensure that we have the national level data. So this has not been the task of TFNC alone. So TFNC is working in collaboration with PureAlch to support regional nutrition officers, but also district nutrition officers to make sure that they collect data timely, but also the regional nutrition officers to consolidate and validate this data before upload and producing the scorecard. Next. So this is a snapshot of how is it used. it's a diagram that I like to present because it has all it takes from the production that you see the small boxes. You see these are real months, and after every quarter you will have to analyze the third item point in the activity level is to analyze the scorecard and propose key actions. So the district and regional nutrition officers will have to analyze the scorecard, come up with the tangible, actionable action points that can suffice the implementation of this action in the whole period until the next quarter comes. So these actions can either be actions within one quarter, or they can be actions that are being implemented across the year. So that is upon how do they formulate the actions to make sure that whatever is in the action plan, whatever is in the scorecard, we have strong actions that are behind the related indicators that are being seen in the subnational level scorecard, which means is being pegged in the output level indicators, which drives implementation of nutrition intervention in the country. Next. So I'm not sure if you can see this well, but this is a snapshot like the whole scorecard itself at national level. So you can see you have on your left the names of the regions. So on the left you have the names of the region, and on the top you have the names of the indicators. So for example, how is it used? I have 3 boxes. I have put 3 boxes here. The first one, the one in green, you can see that you have a lot of greens with small yellows and red. So to easen up or to facilitate data visualization, the scorecard can facilitate an easy way of looking and analyzing the spot. So you can spot check. You see you have 1 red, 2 yellow, and one white, which means you don't have any data here. So this makes life easier to go and dig down deeper and see what is happening with regard to this indicator in terms of this region that have yellow and red, but also to further do the analysis and comparison between the regions. Like where you see the red one, the first one in red, you have a mixture of red, yellow, and blue, which means you have regional disparities. There is great regional disparities in the implementation of this specific task, which is actually mothers or caregiver who have been cancelled on IYCF in the previous quarter. But also you can see in the last one, in the last further right box, where you have nearly all the reds. This is a funding funding indicator, which you can see you have predominantly all the reds and few yellow. This is because much is being budgeted, but a few expenditure with that regard is low. So that is how you can see the scorecard itself. But the scorecard, if you go down to one of the region, you can see the performance with regard to the councils that are in that particular region. Next, please.
Adam, this is Deborah. Sorry, we have a lot of questions coming in. So if I could ask you to go a bit quicker for the last slides so that we have enough time to answer the questions, because they're very interesting. Thank you.
All right. Okay. So this is one of the example of a region that has been using the scorecard. So this is one of the region that they have produced. This is one of the visualization tool that have been used. Is line graph. It's embedded like line graph, and you have the yellow red. This is show performance. So this is one of the region that have used simple analysis tools in their management meetings, which is actually an action that has tracked agreed performance in the local meetings, but also support the implementation status, means evaluating the implementation status of nutrition intervention in that particular area. Next, please. Next. And this is one of the other regions, which is bare regions, of which they have ensured they have enough action items on the budget expended. So you can see in one quarter you have nearly all the reds and one green, but when they have put actions on percentage of funds that have been expended against budgeted, and this action was entitled to a person that is required to ensure that they have, you can see you have the green and yellow, which means in that action tracker, it helps them to increase the budget that they have received. But also they have ensured that they have action tracker in all the other sub-regional levels, which are the councils. Next, please. So this is another way that they have used. You can see in the action description, you have the word in Swahili. So these are their own actions that they have put to make sure that they are following up the implementation in that particular quarter. Next, please. Next. So another example is for Songwe region, where the chairperson for the regional multisectoral steering committee meetings identified 2 indicators, that is IFA and vitamin A coverage, which they put several actions that have resulted in the increase in iron folic acid supplementation coverage from 76 to 98, and then vitamin A from 89 to 102, which means they have like total, nearly total, all the children that were supposed to be covered by vitamin A supplementation were covered in that particular quarter. Next. So in terms of challenge, we have them into different blocks, which the first of all, in terms of capacity, we still have inadequate capacity in managing and use, but also inconsistency in data collection for the proposed indicators between the councils. Because as I've mentioned earlier, that we have several tools that are being used to collect data from the LGA level. But also in terms of human resource, we know that indicators in sector department has to be collected and managed from various departments within the councils. In terms of infrastructure, we know that we lack also adequate ICT equipment at regional level, sub-regional level, but also lack of anthropometric equipment, which will in turn ensure that we have anthropometric indices in the data for anthropometric indices that are available, that are currently collected but are not being collected enough because of lack of anthropometric equipment, but also an availability of harmonized tool between partners at council level, sub-regional level. In terms of finance, we know that we have variability in timelines of collecting data for sectoral departments, but also we need to strengthen the use of scorecard and action track at all levels in routine management meetings, but also in partner meetings to make sure that we are using the scorecard to inform the decision that we are making in the management meetings that we're taking. Next. Next. So the current updates which will provide a one-stop center for holistic data needs with regard to nutrition. This move will ensure will enable nutrition scorecard to be produced automatically and as one of the data product of the system. So as TFNC and other partners in the country, we are developing a multisectoral nutrition information platform in DHS2, which collects data from other systems such as HMIS, ARDS, NSMIS WASH, but also the plan rep. All these together will be in one platform, and this will enable us to produce the scorecard automatically without now migrating from the system to the Excel template and then to the system. Next. So in conclusion, with the scorecard, we have a dynamic tool that will aid the evaluation of the implementation of MNAP. We hope that even the next MNAP will be also evaluated using the scorecard with a few selected indicators of priority. We now have over 100 accounts accessing the nutrition scorecard. We should put more emphasis to further disseminate to a diverse audience at all levels. But moving to a harmonized multi-sector nutrition platform in DHS2, we're in better position to ensure sustainability of the scorecard, but also interoperability with other visualization tools. TFNC, in collaboration with stakeholders, will work to deal with the identified challenges to ensure availability of evidences, evidence-based information, but also to ensure that we have enough evidences to cater for learning platform that TFNC is working on. But also we call for further support in the implementation of actions that are identified in the scorecard to address underperforming indicators within the region and district, so that we can make sure that we have a system that speaks to the operational needs within the nutrition landscape in Tanzania. Next, please. So that is my last slide. It will be adjusted to not mention the support that the government, the central government, is giving TFNC to make sure that we have enable environment to implement the scorecard, but also to ALMA who were there since the beginning of these processes. UNICEF have been tireless in making sure that the multi-sector nutrition information system is there. WFP through the process, CIF, PRILG, who are partnering with TFNC to produce the data from the regional and councils, but also the Minister of Health, Minister of Agriculture, but also University of Dar es Salaam for their support in making sure that we have the linkages between the scorecard and MNIS, and also to make sure that we have a scorecard produced by the system automatically. So that's it. Thank you very much.
Thank you, Adam. It's been a great presentation. We have a lot of questions that have come through the chat box. Let's try to address all of them if we can. I mean, you have already answered, I think, a couple of questions such as, is the scorecard public? If others, such as partners, can access it, and which platform it's hosted on. So I think you have seen, everybody has seen the answers in the presentation. We will share also the presentation and the recording. There are, however, a couple of questions that I will ask the TFNC team, and you will decide who is best placed to answer from your end. I will mention them in no particular order, so just let's go through one by one. Are all data, the first one, are all data linked directly to nutrition outcomes, that meaning different type of malnutrition, or are you also monitoring intermediate outcomes such as dietary diversity? And if we can try and get maybe just very briefly answering the questions, because as I said, there are many that have come through, which is great. So anyone, Germana or Deborah or Adam? So are you tracking nutrition outcomes, or are you tracking also intermediate outcomes in the scorecard?
I will let Hancy answer that. Hans, please, you know more of the indicators.
So the indicators in the, the data that are in the scorecard are linked with both nutrition outcomes. This means the types of malnutrition, but also nutrition outcomes such as the diet one. So we have indicators such as minimum adequate diet among children 6 to 23 months, which is an impact level indicator. But this now is contributed now with the output level indicators, such as the proportion of mothers who have been receiving counseling on IOICF, but also other indicators such as the proportion household with food insecurity and other indicators that are in the output level. So yes, they track both indicators at impact level and also outcome level indicators.
Great. And then perhaps a related question to this about targets. Are there targets for each region, or is there a national target then and then is applied to each region? Talking about indicators. Who would like?
Thank you. So so we have the national level, we have the national scorecard, which are formulated, the indicators are formulated and given thresholds according to the MNAP. In the MNAP, we have set targets that the country needs to reach. So these targets are being adopted by all regions, but if the regions want to have their own target, which is basically to be the same as the national target, but they can increase according to their level or the pace of implementation. So they can do that. So when you view the national level, you can have the data with the threshold that are being set centrally, but also they can customize their scorecard.
Great. And next question, which also relates a bit to targets indicators. How do you collect data at particularly a subnational level? Do you work with organizations? Does the TFNC do that directly? Do you have people at subnational level doing that for you?
So as we've said, this is not a primary data collection platform. We mainly use existing data sources. So for example, a Ministry of Agriculture, they definitely have quite a number of indicators that they already connect through their own systems, such as number of livestock or proportion of, or things like that. And then what we do is we just pull in this information into our platform so that we can link this with outcomes that are related to nutrition directly. So for example, the question on proportion of children, for example, who eat a diversified diet could be an indicator. Then if you want to link this with increase in number of animals within households or number of animals that are slaughtered or are sold, that creates an ability to link this nutrition indicator with information that is already collected through another sector. So we don't do the primary collection, with exception of a few data that is not collected by anyone at the moment, but the majority of the data is collected through routine means within specific sectors. So we do not have people who collect primary data except for those few indicators.
Thank you, Germana. And as you just explained that multiple data sources and multiple departments are involved in the data supply, how challenging it is for you to maintain an updated scorecard. And also you only mentioned health, I guess health indicators and health resources. Do you also have academia research featuring in the scorecard? So two questions. One on how you ensure updated scorecard, considering how many people feed into it. The second one is it just health or is it also academia and research who provide information?
So Hancy will clarify more. The way the system works is it's already linked into these pre-existing routine data collections. So what we have to ensure is that that data source from that particular sector is already imputed in their system. And that's where the regional nutrition officers and district nutrition officers play a key part, in that they have to make sure that the data sources for all sectors in the subnational levels are imputed into their respective system so that the nutrition scorecard can now go and fetch the data and aggregate it in the nutrition scorecard. So the most important job they have to do is make sure that the routine data of each sector is filled in at the right time. And yes, we do also include information from academia, such as small studies and all that, but we do this more at a national level rather than at a subnational level. And these information help us to validate the outcome and impact indicators that we see. And sometimes they also help to support, for example, in between demographic health surveys, we can have these small academic data support us in giving us an indication on whether we are moving towards the right direction.
Fantastic. We have a couple of questions that are related to the link between scorecards and common results framework. Particularly, I think the colleagues from Zambia online, they're saying that they are contemplating developing a common results framework and nutrition scorecard. So what has been your experience in linking the two of them?
I will let Hancy answer that.
So as we know that the common results framework consists of indicators that measures performance of the action plan itself. So you have a lot of indicators. So like Germana was speaking earlier on, we have criteria of choosing the indicators because the indicator in the scorecard have to be the priority one at that particular period, and then they should be actionable, that they should have a sense of making sure that you can have actions that are behind the indicator itself. So you choose indicators and you place them in waves. So you can have several waves. In the scorecard, you have 3 waves. So you are creating a scenario that the analysis has been done, and choose between the indicators within the graph. Which ones do you want to track them first? Which ones will come after them, after the one that you have chosen first? Then the betterment of an indicator, if you have green all the times, you can link the indicators with other follow-up indicators that can be tracked subsequently. But also the indicators in the scorecard should reflect the current intervention that are being implemented. So not all indicators in the graph can be featured in a scorecard at one particular point. But also scorecard is a dynamic tool that can be changed over time. It is a matter of calling the relevant stakeholders and agree that these are indicators of priority. We want for this particular time to measure them. But also, as one of the question was raised here, how do you link them? Now, these output level indicators are to be linked to with the outcome level indicators, which the country is trying to actually measure the performance in. So that is how you do it. But also, you make sure that all these indicators, you don't choose a lot of indicators, because if you have a lot of indicators, sometimes can be tiresome to follow, to make sure that you follow them up accordingly. Because if you have 30 indicators, each indicators have 5 actions, you have 150 actions to follow up. And if this is to initiate dialogue in the meetings, in the regular nutrition management meetings, it means we should focus on few results, on few areas that we need to follow up and track their progress. Thank you.
Thank you, Adam. So we have a few more minutes. In the meantime, please do continue to put your questions in the chat box. We'll try to answer in writing if we cannot have your questions in person. There is a question on data interpretation. We have not talked about this. So Adam, Germana, Deborah, are there any guidance? Is there any guidance material that is given on data interpretation as you examine the data visualization and the action tracker? As you know, many indicators can be of multisectoral nature, so they can also perhaps be interpreted in different ways. So what has been your experience in interpreting, in data interpretation? Thank you. Who would like to answer this?
Hans, can you chip in on this?
So that that was a question also from Deborah from TFNC team. We had a slide of that, but we assume it to be a lot of things to say. So we have sessions that are meant to capacitate the admins and to be able to make sure that they are using the data. As I have been, as in one of my slides, I've shown you, you have like a line graph with yellow, green, and red boxes. So that is a visualization, but also an analysis app that the district or regional nutrition officers have produced within the scorecard to make sure that they are presenting in their management meetings. So capacitating them, but also the scorecard has a manual that stipulates how to analyze the data in the scorecard using the simple visualization tools that are embedded in the tool.
Thank you, Adam. I think we have the colleagues of Zambia who have shared a comment. Just for you to know that the Tanzania team, the colleagues of Zambia are supporting the Nutrition Commission to develop scorecard and common results framework. I would like to connect with the Tanzania Food and Nutrition team. I think it will be a great way to connect to some countries who are working in nutrition. So we will share the contacts later so that you can also hopefully work and support each other. We have a few more questions, and if you don't mind, we take maybe another minute or two. You have a question from Diego. Congratulations, Tanzania. Facilitating progress on the scorecard work. Fascinating progress on the scorecard work. What are the next steps to build capacity of RHMTs and nutrition steering committees in scorecard analysis? Are there any partners planning to support this in 2020? So who would like to answer the question from Diego about?
Thank you, Diego, for a great question. I think we're going strong now that we are planning to go online, making it interactive so that we minimize some of the reporting and imputing or drawing graphs that are being done somewhat manually. And we would like this now to be more automated. So Hancy is working really hard. We're hoping if things go well by July of this year, we shall start field testing if this is possible throughout the country, and also look at alternative means that maybe we can use mobile phones or tablets so that the regional nutrition officers and district government can also access it through other means. So the plan is now to go interactive, and we do have some resources to enable us to achieve that in the upcoming financial year.
Great, and perhaps we take one more question from the chat box because we are already over 1 hour. There is the question posed by Julian. Very interesting, your work on the scorecard. Can you evaluate also the resources in terms of HR, material funds that are approximately necessary for the maintenance of the scorecard system? I think this is a very good question to conclude, because any country would like to put in place a similar system, we should also evaluate what are the needs. So the Tanzania team, who would like to answer this question?
Hancy, please.
In terms of human resource, this is very relevant because you cannot do anything if you have no an ideal personnel that will work on the scorecard development. So the basic need is to have someone placed with every other duties, but to our case, we have the regional nutrition officers and district nutrition officers who are overseeing the production of the scorecard and amendment of the scorecard at that particular level. This also is in line with other sectoral departments' availability of human resource. In terms of materials now, as in one of my slides, I've mentioned on the ICT equipment, which they will need to have a computer that will be used to migrate the data. But also, in terms of anthropometric indices, you need the facilities to have the anthropometric equipment to measure height, weight of the children so that you can have the data input in the system.
Hello, Adam. Yes, I think we lost you. Perhaps the connection has left us. Germana, are you still there? Adam, we could not hear you anymore.
I'm still here. I think Deborah is still here.
Well, I think Adam had the chance to say again, you need the system, you need the
How do we now make use of the
yes,
scorecard?
Adam,
This scorecard itself. So that in terms of
Adam, I think you're breaking up. Yes, you're right. I think we lost the connection there. Since we are already, I think, few minutes past the hour, I will suggest that we conclude here. First of all, thank you all for participating so actively. Special thank you to our speakers from Tanzania, Germana, Deborah, and Adam, who have been so fantastic in sharing their experience. We really hope you enjoyed the webinar. A recording will be available on the Data for Nutrition YouTube channel. We will also share copies of presentation and summary of Q&A. And for those of you who would like to connect directly with the Tanzania team, please do not hesitate. You see, they are really available to answer any question and to facilitate any collaboration. They have so much experience in preparing and supporting and maintaining this scorecard that I'm sure they will help other countries. And I wish you all, first, thank you again to the colleagues of the Data for Nutrition to support in the organization of this webinar. I wish you all a great afternoon, evening, or morning. And most importantly, stay well and stay safe. Bye-bye.
Bye.
Bye.